The United States stands apart from other developed nations in a way that is both striking and troubling: the exorbitant cost of healthcare. Americans pay far more for medical care than citizens of other wealthy countries, yet our health outcomes often lag behind. This disparity raises a fundamental question: why is healthcare in the US so expensive? The answer, as we'll explore, is multifaceted and complex, involving a confluence of factors that have driven up costs while failing to deliver commensurate value. Consider this. In 2021, the US spent over $4 trillion on healthcare, a staggering figure that represents nearly 20% of the nation's gross domestic product. This translates to an average of over $12,500 per person, more than double the average spending in other developed countries. Yet, despite these massive expenditures, the US has lower life expectancy and higher rates of chronic disease than many of its peers. This stark reality underscores the urgent need to understand the root causes of high healthcare costs in the US. By delving into the intricacies of the system, we can begin to identify potential solutions and chart a path towards a more equitable and sustainable healthcare future. This is not just an economic imperative, it is a moral one. Access to affordable, quality healthcare is a fundamental right, and we must strive to create a system that reflects this principle. This journey into the heart of the US healthcare system will be both eye-opening and thought-provoking. It will challenge conventional wisdom and expose systemic flaws that have become deeply entrenched. But it is a journey we must undertake if we are to find meaningful solutions and ensure that healthcare is accessible and affordable for all Americans. To understand why US healthcare is so expensive, it's crucial to peel back the layers and examine the factors that contribute to this complex issue. One key difference between the US system and those of other developed countries is the lack of a universal, publicly funded healthcare system. Instead, the US relies on a patchwork system of private insurance, employer-sponsored coverage, and government programs like Medicare and Medicaid. This fragmented system creates significant administrative overhead. Healthcare providers must navigate a complex web of insurance plans, each with its own set of rules, billing codes, and reimbursement rates. This administrative burden consumes a significant portion of healthcare spending, diverting resources away from direct patient care. In contrast, countries with universal healthcare systems often have simpler, more streamlined administrative processes, which helps to control costs. Another major cost driver is the high price of medical services and procedures in the US. From prescription drugs to hospital stays, Americans pay significantly more for healthcare than citizens of other developed countries. Several factors contribute to this price disparity, including limited price regulation, market consolidation, and a lack of transparency in pricing. Unlike many other developed nations, the US government does not directly regulate the prices of most healthcare services and products. This allows hospitals, pharmaceutical companies, and other healthcare providers to set prices based on market forces, which can lead to inflated prices, particularly in areas with limited competition. Furthermore, the US healthcare market has seen significant consolidation in recent years, with large hospital systems and insurance companies gaining considerable market power. This concentration of power can limit competition and drive up prices. The lack of price transparency in the US healthcare system further exacerbates the problem. Patients often have little to no information about the cost of medical services before receiving care, making it difficult to compare prices or shop around for more affordable options. This lack of transparency allows healthcare providers to charge high prices without fear of losing patients to competitors, contributing to the overall high cost of healthcare in the US. The US healthcare system is often criticized for its administrative complexity, which adds layers of bureaucracy and costs that are ultimately passed on to patients. Unlike many other developed countries with streamlined, single-payer systems, the US relies on a multi-payer system involving a multitude of private insurance companies, each with its own set of rules and regulations. This fragmented system creates a significant administrative burden for healthcare providers. Doctors and hospitals must navigate a complex web of insurance plans, each with its own set of billing codes, reimbursement rates, and pre-authorization requirements. This administrative labyrinth requires a small army of staff to manage, from billing specialists to insurance coordinators, adding to the overall cost of healthcare. The administrative burden extends beyond healthcare providers, impacting patients as well. Navigating the complexities of insurance plans, deciphering medical bills, and appealing denied claims can be a daunting and time-consuming process. The lack of transparency in billing practices and the prevalence of surprise medical bills from out-of-network providers further contribute to the frustration and financial strain faced by many Americans. This administrative complexity not only drives up costs, but also detracts from the quality of care. Doctors and nurses often spend valuable time dealing with insurance-related paperwork and bureaucratic hurdles, time that could be better spent providing direct patient care. The focus on administrative tasks can lead to physician burnout and detract from the doctor-patient relationship. Addressing the administrative inefficiencies within the U.S. healthcare system is crucial to controlling costs and improving patient care. Simplifying billing practices, standardizing insurance forms, and promoting greater transparency in pricing would streamline the system and reduce the administrative burden on both providers and patients. By tackling these bureaucratic hurdles, we can free up resources to focus on what truly matters, delivering high-quality, affordable healthcare to all Americans. The principles of supply and demand, while fundamental to a functioning market, often contribute to the high cost of healthcare in the U.S. Unlike other goods and services, healthcare is often considered a necessity, and demand remains relatively inelastic, meaning that price changes have a limited impact on demand. This dynamic creates an environment where healthcare providers and pharmaceutical companies have significant leverage in setting prices. The U.S. healthcare market is characterized by a lack of price transparency and limited competition, which further exacerbates the impact of supply and demand on pricing. Patients often have little information about the cost of medical services before receiving care, making it difficult to compare prices or shop around for more affordable options. This lack of transparency allows healthcare providers to charge high prices without fear of losing patients to competitors. Furthermore, the U.S. healthcare market has seen significant consolidation in recent years, with large hospital systems and insurance companies gaining considerable market power. This concentration of power can limit competition and drive up prices. For example, when a single hospital system dominates a particular region, it faces less pressure to keep prices competitive, as patients may have limited alternatives. The pharmaceutical industry provides a stark example of how market forces can drive up healthcare costs. Pharmaceutical companies in the U.S. enjoy significant market power and face limited price regulation, allowing them to charge high prices for prescription drugs, even for life-saving medications. The lack of government negotiation power further contributes to the high cost of pharmaceuticals in the U.S., as the government, the largest purchaser of healthcare, is prohibited from negotiating drug prices with pharmaceutical companies. Addressing the role of market forces in driving up healthcare costs requires a multifaceted approach. Promoting price transparency, fostering competition within the healthcare market, and exploring mechanisms for price regulation, particularly for essential medical services and pharmaceuticals, are crucial steps towards a more affordable healthcare system. The high cost of prescription drugs in the U.S. is a significant contributor to the overall high cost of healthcare. Americans pay significantly more for prescription drugs than citizens of other developed countries, often facing impossible choices between affording their medications and other essential needs. Several factors contribute to this price disparity, including a lack of price regulation, the influence of pharmaceutical lobbying, and the complex system of drug pricing and distribution. Unlike many other developed nations, the U.S. government does not directly regulate the prices of prescription drugs. Pharmaceutical companies have considerable freedom to set prices based on market forces, which can lead to exorbitant prices, particularly for life-saving medications with limited or no generic alternatives. This lack of price control stands in stark contrast to other countries, where governments negotiate drug prices with pharmaceutical companies or set price ceilings to ensure affordability. The pharmaceutical industry wields significant influence in Washington, spending billions of dollars each year on lobbying efforts to shape healthcare policy in their favor. This lobbying power has effectively blocked attempts to implement price controls or allow Medicare to negotiate drug prices, further contributing to the high cost of prescription drugs for American consumers. The complex system of drug pricing and distribution in the U.S. also plays a role in driving up costs. Pharmacy benefit managers, PBMs, intermediaries between drug manufacturers and insurers, were initially intended to negotiate lower drug prices. However, the system has become increasingly opaque, with rebates and discounts negotiated by PBMs often failing to translate into lower out-of-pocket costs for patients. Addressing the high cost of prescription drugs requires a comprehensive approach that includes increasing price transparency, allowing Medicare to negotiate drug prices, exploring mechanisms for price regulation, and promoting the development and availability of generic alternatives. By tackling these complex issues head-on, we can make essential medications more affordable and accessible to all Americans.